Dr. Moreton devoted his life to medical innovation on behalf of his patients, and this year's award recipient, Dr. Don Powell, Professor Emeritus in the Department of Internal Medicine, Gastroenterology at the University of Texas Medical Branch in Galveston, has spent his own life in much the same way. And today, Dr. Powell joins Dr. Donald DiPette, the Health Sciences Distinguished Professor and previous Dean of the University of South Carolina School of Medicine in Columbia, to discuss his career as well as changes in medicine, including innovations in the care of patients with gastrointestinal disease. He will also offer some words of wisdom to young individuals who are pursuing a career in medicine. Thank you both for being here.
Well, Jennifer, thank you for that kind invitation, and a big hello, Don. It is wonderful to be with you again, especially for this podcast. We have been together quite a bit in our careers, but never anything like this before. So
that's true. That's true.
Also, Don, congratulations on the Moreton Award. It means a lot to the Southern Medical Association, and it is truly deserving of the award to you. And I want you to hear that heartfelt. We'll have another opportunity as part of our annual meeting to honor you again, and also to hear more and a greater presentation of what you deem is important for our audience and our association, and particularly our young students, residents, and faculty to hear. But I've got a couple questions I've been dying to ask you, if you'll just humor me.
Surely.
Don, Dr. Moreton devoted his life to medical innovation. Over your career, what are some of the medical innovations that markedly changed the care of the patient with gastrointestinal disease?
Well, Don, I've had an opportunity to be on sort of the ground floor of one of the innovations. That's gastrointestinal endoscopy. After I'd finished undergraduate school at Auburn, I went to the University of Alabama to ask for a job in the summer before school started. And they assigned me and got me a job with a young gastroenterologist named Basil Hershowitz. I heard of him, but he was the man that invented the fiber optic endoscope, which has really revolutionized medicine for not just gastrointestinal diseases, but cancer, a whole host of things. Because before that time, there was no way to have a visual image that could be manipulated so that everything was rigid. It had to be a straight shot. And what he did when he was at the University of Michigan, discover or to realize that fiber optics could transmit an image from one end to the other. So he got together with some graduate students in physics, and in the basement of the physics building, they built a fiber bundle so that the image on one end was reproduced well on the other end. And this was the start of the fiber optic endoscope. He came down to Birmingham as the new chief of gastroenterology the same year that I matriculated as a freshman there. He had the first working prototype of that. So I had the opportunity to, working with him for 4 years, I had the opportunity to see this endoscope in action. Before that time, everything was like sword swallowing. We had a straight, narrow, barely bendable instrument that you could look into one's stomach. You couldn't look in the duodenum. You couldn't get past the pylorus. But with this fiber optic bendable instrument, you could get into the stomach easily without anesthesia. You could go down and look into the small intestine, and it just absolutely revolutionized medicine, or at least gastroenterology. As you know, their gastroenterology, and now the endoscopy is the hallmark of that specialty. It wasn't that way when I started, because when I started, it was cognitive specialty like internal medicine, because we had no really good technology. But boy, it has really revolutionized gastroenterology. And gastroenterology is what it is today because of that endoscope that he invented in the early 1960s.
So you're bringing back bad memories, even of myself, with my first rigid sigmoidoscopy. That did not go well.
You're right. You're right.
Yes, I'm one of the beneficiaries of that endoscopy, flexible endoscopy.
Haven't we all been at one time or another? The other major innovation in gastrointestinal diseases, as in all medical diseases, was the advent of computerized tomography, or the CT scan. You have to realize what it was like before CT. I mean, it was hard to make a diagnosis of appendicitis. People missed appendicitis because it was all based on clinical findings. And some people were quite good at that. Others were not so good. So a lot of people had ruptured appendices that probably didn't need to happen. These scans absolutely revolutionized that, as it did for almost all internal diseases. So I think CT was the other great advantage, or the great advance in GI diseases, but also in all of medicine. The third, I think, really significant thing in my career was the development of hepatitis C drugs. Hepatitis C was a scourge when I was coming up as a young professor, and I happened to get selected to run a consensus conference at the NIH to try to decide whether interferon, which was the first drug ever to be used for successfully to cure hepatitis C, and it caused so many side effects, and its efficacy was so poor, less than 1% of people got cured with this drug, and it had major side effects. So the big question was, should we even use interferon for treatment? The NIH felt that we should develop a consensus on this important question. So they convened a consensus conference, and they asked me to be the head of that conference because, not being a hepatologist, I had no particular bias in the field. And then we proceeded to meet night and day for 3 days, and finally approved this drug for treatment, in spite of the fact that it only had a cure rate of about 20% and a huge amount of side effects, including depression and suicide and anemia and a host of other diseases or side effects. But it was approved. And then from that point on, the pharmaceutical companies began to really develop effective antiviral drugs, so that now we have therapies for hepatitis C that are 90 to 95% effective.
Don, as an internist, I was just thinking along with you. Obviously, those are absolutely remarkable discoveries that have changed our lives as physicians, but more importantly, lives of people. I mean, these are real people at the end of the day. I was thinking also about peptic ulcer disease being an infectious disease. Sometimes I'll even, you're going to think I'm a little weird, but I'll be driving to work and I'll start thinking about things like this. And one of those, and the story of that is fascinating. If I remember right, or maybe it's been embellished, the individuals that first thought about that or even came up with that hypothesis were kind of like, not run out of town, sort of like on a rail, but just dismissed.
Well,
I guess what does that tell us about new discoveries or sticking with your intuition, or what does it mean?
You're absolutely right, Don, that really revolutionary findings are often looked askance by people, particularly people in the field. And this goes back to ancient times with Galileo and others. And this is exactly what happened with Barry Marshall. He introduced an idea that people just didn't want to believe because they were invested in other hypotheses as to the cause of peptic ulcer disease. But he and his pathologist partner, who went on to show that this was indeed the case, and of course they won the Nobel Prize. So they actually pretty much showed them that they were correct, and that was acknowledged as it should have been by society as a whole. So that was that's not an unusual thing. And people that have new discoveries, if they're certain of them, they need to proceed on and not be discouraged because if they're right, sooner or later, society and the medical profession or the scientific world will agree with them.
Well, thanks, Don, for some of that reflection. And I'm sure there's many, many more. And the members of our audience that are listening can also think of their own and reflect and do some reflection.
Exactly.
Changing the subject a little bit. I've known you for so long. You've had a remarkable career in medicine, but not just medicine, as a clinician, educator, researcher, and administrator. From your perspective today, even looking today and or looking back, were there any defining events, individuals, et cetera, that guided your career or made a significant difference, sort of an aha moment that perhaps we can learn from?
Absolutely. So I think in everyone's career, there are people that are sentinel figures that change the course of one's life. First one for me was a biochemistry professor at Auburn University, where I was an undergraduate studying chemical engineering. I had gotten through 3 years of that, had taken all the hard courses, had done pretty well, but I didn't really like it. And I thought, if my life is going to be spent doing electrical circuit analysis, worrying about the second law of thermodynamics as it relates to chemical engineering, then that's not for me. I had read a book by a man named Sinclair Lewis called Aerosmith, and it's about a young physician who gets interested in research and becomes a clinician scientist. It was modeled after the Rockefeller University's experience in this area. And I said, that sounds fun. Maybe I should really think about medicine. So I decided to take a course in Introduction to Biochemistry. And there was a young professor there named Paul Milius, and he turned me on to the idea that my initial love for chemistry could really be enhanced in biochemistry as it relates to humans. I took that course, and then I went to work for him in his laboratory as an assistant, and kind of got really interested in research. And that really changed the whole course of my life. The second person is the one I've already talked about.
Yes.
Dershowitz. When I came to medical school, I went to work for him and worked for him for 4 years. He was not only just a person that hired me as a person to help do his research. He was a real mentor. He helped me decide that I really did want to go into academic medicine, and I had a very productive time. I had 2 major first authored papers by the time I finished medical school, which is pretty good in those days. But he was a wonderful person. We worked in his lab, and we worked with animals, and we worked at the bench, but then he would take us up on rounds because he was a true clinician scientist. Loved to go, at the end of the day, would go on rounds with him. And that's what made me decide to really change my views a lot. The third person, I think, that really changed my life, so not so much in the area of medicine, but in the whole area of human endeavor and race relations, was a nephrologist that I met at Yale by the name of Arthur Finn. Art was very much in that day, now this was back in the 1960s, very much into supporting minorities. In fact, he was the physician for the Black Panthers in New York. And that was a day when this was almost heresy. I mean, to do that, I mean, you had to be brave. And I got to be good friends with him. And in that interaction with him and talking about race and race issues, I came to realize that growing up in the deep South, like I had prejudices that I had to overcome that were unfounded for any particular reason. And over the year or two with him, it's changed my whole life as it regards to interactions with other people. And I'm forever grateful to Art for that. He was quite a person in an era when it took bravery to be a civil rights advocate. I credit him with a lot of that and changing my whole view of sociology as it relates to place. He also had already accepted a job down at the University of North Carolina in Chapel Hill, and he told the chairman there that they ought to hire me. So they came, looked at me, and I actually went there for my first job, and I spent 20 years there, really 20 very productive and enjoyable years, my first real job in academic medicine. So those are the three people that I think changed my life in really fundamental ways.
Don, that's wonderful, and thank you for sharing that. Particularly the last individual. I think it was Dr. Finn that you mentioned.
Yes, Art Finn, yeah.
That sort of leads into my next thought. These are turbulent times in many respects. Of course, we'd be remiss if we didn't mention the COVID pandemic. And I'm an internal optimist, and I believe there's going to be light at the end of the tunnel. But there's been good things in medicine, even that I've reflected upon or seen, and maybe some not so good things in medicine. Over your career, what would you say are some of the good things that have happened to medicine, and maybe even, and being honest, like you were very honest about race and divisiveness, et cetera, and maybe not even some of the not so good things in medicine?
Sure. Well, the first, I think, really important advance is the whole field of technology that we've also already discussed, but also the development of effective medications and drugs. You have to realize that back in 1960, when I 60s, when I graduated from medical school, there weren't many really effective drugs. And so over the last 50 years, we've developed not only the technology that we've already talked about, but also medications that really effectively treat disease. And that, I think, has been one of the wonderful things that's happened. Our knowledge base, our understanding of disease has advanced dramatically. And now we're about to enter, I think, a whole new era of artificial intelligence. Artificial intelligence is going to change medicine. It's already changing gastroenterology. You can use these artificial intelligence algorithms, and you can improve. They can do as well at identifying adenomas and cancers at endoscopy as the most experienced gastroenterologists. So you put those two together and you have a wonderful advance, and it's going to be like that in a lot of medical fields. So artificial intelligence is yet to really see the full fruition of that, but it's going to be there. It's going to be exciting. Now, what about the bad things? The thing that really bothers me the most, the lack of support for healthcare for people that don't have it. I mean, I've spent a great deal of my career in state institutions. That means we take care of poor people. If you practice in states like I'm in that don't have expanded Medicaid, then people don't have support for medical care if they don't have means and private insurance. So there are huge numbers of people without support for medication and for treatment. And I think that's really, I think it's unconscionable in the richest country in the world that we have people who can't get adequate medical care. And I can tell you it's true. You can say, oh, well, we take care of all these people, but we don't really. And the cost of taking care of, because they all come to the emergency room when they get, so that they don't have any other option. The cost of care in the emergency room is amazingly high. That's the bad part that's happened in medicine. There's some other things that I think are mixed bags. I mean, they're not bad, but they do have, if you will, side effects. Young people and physicians do need to have a work-life balance. And we saw that in the change in training that occurred in the era when you and I were on, when we worked every other night and every other weekend, and never had time for family or anything else. But the one good thing that did was it taught you a sense of responsibility for patients. And when we did away with that, there was this kind of sense that medicine could be done a little bit by shift work, that you had a shift from this amount of time, and then you can just turn over that responsibility to somebody else. That was probably okay. So I don't think that's bad. I think did diminish this idea that a physician has ultimate responsibility for a patient. And the best physicians are the ones that treat all of their patients like their family and like their individual responsibility. So I don't say that's bad. I think it's absolutely necessary. When I look back on the days that we had as trainees, they were terrible. I can remember those nights when we had, just utter fatigue and trying to drive home from a shift to a weekend shift and falling asleep at stoplights because we were sleep deprived and those. So that had to go. But fortunately, there were a little bit of side effects with this idea that people no longer had ultimate and ongoing responsibility.
Thanks, Don, for that, again, for that honesty. I think program directors right now, as we speak, are having an extraordinarily difficult time balancing, the new work hour rules, et cetera, responsibilities with, though, still instilling that patient responsibility, that sense of continuity, that I'm responsible for this patient. Yes, there's breaks. Yes, I can go home. Yes, I can be with family. But the next day I need to get up and I'm still responsible for that same patient. I share the same concerns, actually,
Yeah.
And because we've discussed this together on many occasions. But I still think that our young folks, our young program directors, educators, et cetera, they're gonna figure this out. And the pendulum, maybe, if I could be overly optimistic, the pendulum has to swing a little bit further in one direction before it can come back to the middle. I don't know if it's swinging back or not yet, but hopefully, and I really appreciate you bringing that up, because ordinarily we wouldn't talk about that much.
That's true.
But that does lead us to another point. One of the strategic pillars of the Southern Medical Association is to develop a youth strategy to support our medical students, our young residents and fellows, and even our young physicians, whether they're in academic medicine, practice, healthcare systems, while they're not only in training, but while they're just out of their training and starting their career. Since we just talked about trainees, et cetera, and the environment, what advice or words of wisdom would you give to these young individuals who, let's face it, we're getting older, they are the future of medicine, and we're going to be turning, as we already are, the future of medicine over to these wonderful young women and men.
Yeah. Well, I think the first thing I want to say, Don, is how much I respect them and admire them. Their careers started during the worst pandemic we've experienced since 1918. And this is bound to have had a tremendous effect on medical students, on residents, and on young physicians to have to start their medical careers worrying about whether they're going to catch a fatal disease, or even more worrisome, whether they're going to contract it and take it home to their spouse, their partner, or their family. I admire these young people for having the ability to start their careers in the face of that almost overwhelming event. And they've done it, and they've done it well. And they've maintained, as best I can see, their desire to really continue to help patients and to be good physicians. And so I want to congratulate them. I want to tell them how much I admire them for that. Now, what are some advice that I can give them? Well, I think the most important advice that I can give is that you need a mentor, effective, active mentorship relationship at every stage of your career, in medical school, in residency, as a younger physician, and then even on into your mid-career. because there are many, many different things that happen along the way. And if you have someone who you've engaged in an active mentorship with, that is a person that it's a bi-directional event. You both contribute to it. You both have to make it work. But if you have such a person at each of these stages in your career, then you're going to have a leg up. You're going to not make some mistakes that you might have made on your own. You're going to have more advice and wisdom that you could get in almost any other setting. So my first advice to people is to really try to actively develop, seek out people who can be your mentor. I'm a real believer in mentorship. I think in my own career, it's made a fantastic difference. And I think in the future for most everyone else, it will too. Now, I guess the final thing is that I see physicians sometimes now really go astray financially. Physicians make a good living, but I see people that don't take advantage of that in any effective way. So one of my advices to people, and I've actually said this and actively work for this, I tell these students that you need to get a financial advisor. You need to have someone that's a professional, that understands finance, because doctors are terrible business people. We lose as much money as we've ever made, I tell you. So get a financial advisor, someone that can, and that offloads you from having to worry about that, so that you can focus on advancing your own knowledge of medicine and being a better physician. At the same time, someone's looking after your finances so that your family is going to be secure in the future. So I guess that's my other real piece of advice.
Well, Don, thank you. We're going to again celebrate the award at the SMA annual meeting, but even just listening to this short podcast and some of your reflections, I think it is obvious why you're the award winner this year, Don. It's clear. We could go on, and I would be selfish and want to go on, but to keep it concise, etc. I guess I'll just leave it back to you. Is there any other words of wisdom or inflection or even reflection that you just want to share with us in closing?
All right, the last thing I'd like to say is that I think being a member of medical associations like the SMA is very, very helpful and useful to any professional. They give you guidance, they give you knowledge, they give you career development advice. So all in all, these medical associations are very, very important to one's success as a physician. I admire what the SMA has done, and I'm so overwhelmingly pleased to be named the Moreton Research Professor for this coming year. So I want to thank you very much for that.
Well, Don, you're welcome, but it was easy. In my closing, I'd like to thank Jennifer and Dylan also for getting us together. It's like herding cats where everybody is busy. You got two of us through at least the technological part of getting on and logging in and actually getting on camera and microphone. So Jennifer, thank you, and Dylan as well. And again, we're going to continue to be together when we bestow the award in the upcoming month. Again, Don, thank you very much. And it's just a pleasure to be with you.
Thank you.
Thank you both. This was a wonderful conversation, and I know our listeners will enjoy it. So thank you for your time today.
Thank you.